My name's Sharon Rayner, and I'm assistant professor at the College of Nursing at Thomas Jefferson University. And I participated in a community-driven research project with the Center in the Park. Our research project was titled "The Domino Effect: Understanding the Impact of Opioid Crisis on African American Older Adults."
Hi, I'm Megan McCoy. I'm the Director of Grant Research and Development at Center in the Park, which is a nationally accredited nonprofit senior community center located in the Germantown neighborhood of Philadelphia. And we were a partner on this project, involved, from the development through the dissemination. We were primarily with older adults age 55 plus, and over 92% of our participants are African American.
And my name is Renee Cunningham, and I'm the Executive Director at Center in the Park.
So we came together as a partnership, as a community partnership, to address a community need that was identified at the Center in the Park.
Yeah, and what we had been seeing among our participants, who are primarily 55 and older, and over 92% of our participants are African American. We had been hearing a lot about the opioid crisis, of course, in the news in Philadelphia at the time, and the city had formed an opioid task force. And we'd also been hearing anecdotally from our participants that some had, as a result of the epidemic, become caregivers for grandchildren, as well as we also know that many of our participants were dealing with chronic conditions that involved pain management. So we sensed that there was probably a need for some type of programming potentially around the opioid crisis, but we weren't really sure what direction we should be focused on. So we decided to engage in this study to better understand how our participants were perceiving and understanding the crisis and really what their needs were, so that that could inform our programs.
And just to piggyback on that, that's something that has always been really important to Center in the Park and is really central to our mission, is to listen to our participants' voices. And so we felt it was really important to go to them and ask them how they're perceiving it and how it's impacting them.
So we'd been involved in collaborations before that were really good partnerships. And we also had been a participant in community-driven research day in the past, and we knew that was a great setting within which to sort of take new areas that we were interested in learning more about related to the population we serve, and try to connect with researchers who shared that similar interest.
And from the research perspective, I think being able to engage in community-driven research is really important because it answers a question that specifically impacts the community. And from my research in the opioid epidemic and also generational impacts of the opioid, it was a good fit for me, but I was able to design a study that really met the community's need for a research project. And so I think from the research perspective, that is how a great partnership is formed, where there's an interest, but also an ability to design a study that can meet their question.
I think it's had a lot of benefits. We worked really well with Dr. Rayner. She was a really great partner as the community agency. We speak one language, and kind of research is a whole other language. And so we're really happy, and it worked really well for us that she was very engaged and they were very engaged with us, at our level, and making sure that we, kind of understood things together. We developed the focus groups and the questions. Everything we did really as a real partnership, and we did it together.
And I think we had some ideas about what we thought might be the concerns, and I think we were thinking that the impact within the family might be a primary concern, but really what people were concerned about was understanding, if I am prescribed this medication, am I going to become addicted to it, or what are the side effects involved? And that really was a big piece of what our participants were concerned about. And we wouldn't necessarily have known that if we hadn't done the study.
And so the next question is one is, we started with how is the opioid crisis perceived and experienced, and now, growing from the answer to that, which is, hey, we want more information, more reliable information about opioid medications. It has led to our next research question. And another community-driven research day project, which we're very excited about, which is about how participating in a nurse facilitated opioid education program will increase African American older adults' knowledge of pain prescription, their safety.